All right. You know what it is? You know who it is? We're back. Another episode of the Skinny Boy Says podcast. Today I got another chiropractor on, a good friend of mine, Dr. Justin Amy of Foundation Chiropractic and Magnolia Chiropractic,
Oh, yeah.
and Unstoppable Movement. No chiropractic after that.
All kinds of stuff.
He's getting his hands into. Justin, haven't seen him in a little bit. He's a good dude, very good friend. Excited to kind of sit down and talk. How's everything been going for you, first off? And then I don't know if I want you to give a little bit of a background on yourself too, because I don't know if everybody that's going to be listening to this knows who you are specifically. So go ahead.
All right. So, little background. I'll actually start with how I got into chiropractic a little bit.
It's going to be one of my first questions too.
Yeah.
So.
Perfect. So, I've been into sports all my life, pretty much done soccer or running, something like that, since I was 5 years old. In high school, I used to get back problems all the time where, as a stupid kid, you
just hurt yourself.
Lift improperly.
I can lift that.
Yeah, I can lift 200 pounds without using my legs at all. Sure. So I would injure my back like all the time, and came into college, and my freshman year of college, same thing. Went into our cross country season, injured my back, and my coach was actually the one that told me, "Hey, why don't you go to the chiropractor down the road? See if they can help you out, get you back quicker, get you back in a natural way." So went to the chiropractor, couple visits, 2 or 3 visits of seeing him. Back pain was immediately gone. And I was like, how is that possible?
It seems like all the chiropractors I've talked to have, I mean, that's probably part of the reason why they became a chiropractor, but they've gotten some treatment from chiropractor that's helped them from an injury or something like that. So that's cool, but continue.
Yeah, pretty much. There's tons of stories where people either have some sort of injury where they see a chiropractor, or they have some miracle story that, like, I know there's one chiropractor out there where he had like irritable bowel syndrome, and he was basically on his deathbed and had no other alternative, and was just like, you know what, I'm just going to try this as a last resort. He's been perfect ever since. And Jesus. So sometimes we get those miracle stories, but it's definitely not the norm of what happens.
I mean, that's definitely the last place I would think of. Irritable bowel syndrome.
But I started going to the chiropractor, started picking his brain about what he did, and I always loved science, never really knew in college what I wanted to do with it. And going to him was the thing that pretty much changed my life to the path that I knew I wanted to go down. And it's ironic because nowadays I see people that basically come in a lot of times with the same exact injuries and things that I started out with. So I get to kind of let them know that I've been in their shoes. I've been there. I've dealt with it, and it sucks, but it's definitely something that's treatable. It's definitely something that's correctable most times.
I don't think you deserve to be a chiropractor unless you fucked yourself up multiple times. I don't think it's fair to the other person, but yeah.
I that's one thing I always joke about is, like, I feel like the best chiropractors out there know exactly how to treat many disorders because they've been through it themselves. Yeah. If they haven't fucked up a shoulder or screwed up their low back, it's really hard to treat something when you've never understood that pain.
Or they're just not lifting heavy enough. One of the two. And we don't want either of those as our chiropractors. Yeah. No, that's cool. No, I mean, and it's true. I mean, like, I think as a trainer, especially, like, I mean, I've seen Justin enough times now, but like, if you're not experiencing certain things and taking yourself to a certain level, you can't start telling people how to feel about certain things.
Yeah, exactly. I mean, I'll tell you right now, in my right rhomboid, I have a trigger point that is killing me today. And I've worked on it twice already. Just rolling around on a lacrosse ball, using the hypervolt, like knowing those aspects of like when somebody comes in and goes, yeah, I got some mid-back pain. I know exactly what you're talking about.
Yeah, no, that's true. As a chiropractor, when you have to get treatment, who do you look to go to? Like, you have to go find, so it's like a hairdresser or like a photographer. You can't take pictures of yourself.
This goes into a deep question of our whole entire profession.
Yeah. I'm gonna get there. I have some questions about that.
So what I look for in a chiropractor is I look for someone that is looking not only to treat the area that is problematic, but why is it problematic? I look at especially for myself, I look at the body as a whole. Everything is connected. So if you have something that's going on, say in your low back, it can be coming from other areas of the body. It can be coming from your mid back. It could be coming from your right big toe not being able to extend far enough. Like just everything is connected in the body. So I'm looking for a chiropractor that is also looking for those things. I'm also looking for someone who is, let's go the other end of it, not going to give me a 30 visit treatment plan.
Yeah.
It's something that happens in our profession a lot, and I think it's absolutely ridiculous that it happens, and we can go into why it happens. But,
no, I know why it happens.
Yep.
The wall, it's light.
Yep. So many things, especially musculoskeletal issues in the body, are things that if you take the time to figure out what is going on with those issues, a lot of times they can be corrected in a couple visits. Sometimes with the more chronic issues, things will need a little bit more time, a little bit more treatment. But a lot of times when you have those things where people come in, you've seen them for 45 minutes and you're giving them a 30 visit treatment plan over the next year and a half, there's no way that you're doing that out of good conscience.
Well, I think you gain a validity factor if you're also being upfront, being like, I like, if I'm seeing you here consistently over the next 3 months, I'm not doing my job unless it's something that's like severe or like chronic or, something that's like, like I said, it's severe. Like, if you're seeing someone consistently over a 30-month period and they're like, and maybe like they just enjoy it. Like, sometimes I don't necessarily need treatment. I just like to come in and get stuff worked on. And that's a different story. But like if you're needing to come to the chiropractor and then consistently needing to come to the chiropractor and not feeling better, like you should probably go see another chiropractor or not do what you're doing. Like figure something out.
I mean, like even with myself for visits, like if I'm not seeing any sort of positives after a couple visits, I'm looking at, all right, maybe I'm not the person that you should be seeing. Maybe we need to refer you out to a PT or a specialist or something else, or even just some imaging just to see if I'm missing something.
Yeah.
Because even with what we're doing, like this is one of those things where kind of ego gets in the way of things. I know a lot about the human body and I can give you my best guesstimation of what's going on and how to treat it and how to get it corrected. But there are a lot of times where I might miss something. I might be overlooking something. So
you're also looking at it from you understand it, but it's like you're looking at it from a surface level thing. You can't look inside. So you're just assuming based off of someone's perception of pain, perception of where the actual pain's coming from, how it's acting in the body. And then you have to assume that you have to put it by what they tell you. And a lot of times it's hard. And like, that's another skill of a chiropractor or a trainer or, a physical therapist is actually getting like, all right, feeling and then listening, but also not taking what they say with a grain of salt, because people express pain differently. They express the feelings, or they just don't know how to describe a certain pain. So like, as a chiropractor, you have to dig a little bit. Like, is it a shooting pain? Is it a local pain? Is it radiating? Like what's going on? And they're often like, oh, well, it's kind of doing this. And then you're like, oh, this doesn't hurt. And then you're like, oh, that hurts. It's like, okay, all right. Well, then like, that's what I figured. So
it's one of the biggest things for chiropractic, and we were ingrained this into our heads in school, was that your history is your most important visit.
Yeah.
If you can get a great detailed history of what's going on with a person, you will be able to find out 9 times out of 10 exactly what's going on with them before you even touch them.
Yeah.
Because they'll almost tell you what's going on.
Yeah.
So it's one of those skills that you get over time of asking the right questions and trying to kind of get someone out of their own way. Because a lot of times people are, I don't know if it's like uncomfortable or they just don't really want to tell you some things, but like some people just kind of keep to themselves. And that's one of the worst things you can do if you're in pain, because I'm here to help you.
Yeah.
And if you don't give me all of the information that you can about something, it's going to make it that much more difficult on what I can do.
Yeah. And I've been kind of saying this for a while now, but I think I'm starting to realize as a practitioner and a trainer that as much as the training is important, like almost putting more time and effort into making a better consultation and assessment.
Oh, yeah.
And like, the training is there. And like, for me, I have my idea of training and what I want people to do and what works for me and what works for the people that I work with. But like, for me, I've been putting a lot more effort, a lot more thought, a lot more time and details into like the initial conversation I have with that person and then the initial assessment that I have with that person, because that literally makes your job significantly easier, especially as a chiropractor, as a trainer. Like when you're building something for someone, if you're not asking the right questions, you're going to get the wrong answers eventually, and like, I think people put so much time into their skill of like the treatment or their, you see people online who are doing just crazy things to get attention, like crazy treatments to get attention or like crazy exercises to get attention when the basics work. It's just that the assessment and the consultation are lacking and you kind of don't know how to approach a person and you don't know what they're looking for. So then it's just like fluff and granola and you're trying to fill it and make it look nice. One of the things I want to talk about is that, one of my favorite things about you and like the other chiropractors that I've had on and that I've talked to, Jordan, Jeremy, like these guys aren't, from what I understand, and I've been to a couple other chiropractors and they're not, you guys have a certain approach, and I kind of want you to talk about your approach a little bit to treating someone because it's different and it's not what you normally see. I remember I've been to chiropractors that put you on stim and then they snap you and crack you and then that's it. And you come in for 10 sessions, like you said. But, you guys, I've never, for you, I don't even know if I don't think you have stim in here. I don't think you have that. And like, whenever I'm here, it's 30 minutes of you assessing and kind of going over the body and taking me through stuff. Talk about your approach a little bit to how you treat somebody and then kind of what you're looking for and how you go about it.
So my approach is very much surrounded by, because I love bodybuilding.
He loves bodybuilding. He's huge.
I love the intricacies of the body.
Yeah.
So a lot of times with many things that we deal with on a daily basis, it's not only restrictions through the joints, but it's also a lot of muscle soreness, muscle pain. So I love to work on the muscles. I love to balance out the body. Everybody on a daily basis, no matter what they're doing, are going to have little compensations between muscles that are strong, muscles that are a little bit weaker. And what I like to do is some of the muscles that are a little bit stronger, maybe they're overcompensating for some muscles that need to be stimulated a little bit, need to be balanced out. So I do a lot of muscle work in my treatment. Combinations of, I use my hands a ton. I feel like as a chiropractor, it's one of my biggest tools is being able to feel things with that dexterity of my fingers. I also use what we call our hypervolt, so some vibration therapy, vibrating over the muscles, bringing a little bit more blood flow through there, as well as just being able to turn off some of those pathways for pain, getting into the neuro side of things, trying to get the body to calm down while using a little bit of vibration to kind of get the brain to think about something else. I also use some instruments, some metal like scraping tools and things like that. Again, bringing blood flow to the muscles, getting things to calm down, getting rid of trigger points, and just getting the body to balance out. And then usually after we've done muscle work for about 15 minutes, 20 minutes, that's when I see what else needs to be done. Once you can get some of the muscles to calm down in the body, you can see a change in some of the joints that are restricted that may not be restricted anymore. A lot of times you'll see this with the upper traps, where the upper traps in almost everybody nowadays with desk jobs are constantly tight, constantly stressed out, and you'll feel that restriction through the upper body, through the thoracic spine and lower cervical spine. When you get the traps to relax, you go back through there and palpate and see which is restricted anymore. A lot of times those joints clear up. You have that muscle relaxing, so you have that motion back through those joints again. So just looking at things like that, I can see what muscular wise has cleared out, what still needs to be adjusted for joints that are still restricted. And then that gives that person basically resets their system, kind of like a computer, just resets that nervous system, gets the joints moving, gets the muscles moving. Everything is good again.
Yeah. And like I said, that's not, unfortunately, that's not like common. And like that's a problem. Like, unfortunately there's people who don't think of it in that level. And like, that's why I wanted him to go through it, is because like, that's the kind of level of attention and detail you're getting from these top level chiropractors. And like, going into it, you should never have to question if something is working. And like, there should be, for the most part, especially with something like treatment wise, there should be something at least given or felt, or some information handed down to you that's letting you know right away that like there is going to be a change. And like, just understanding that level of details kind of going into it is just, it's different, Next question, kind of leading into, what we just talked about, is you're talking about using your hands and kind of being able to feel with the coronavirus and COVID and all that stuff, and the uncertainty and social distancing, which most likely we're breaking right now. But
we're about 6 feet.
But making a slight adjustment to having to work with some clients online and be a little bit more, I guess, distant from a client. How do you approach that and helping them to try to still give them that top level like service, but not be there and be able to touch them?
Good question. That's been a huge change for me. That's one of, like they always say, like as an educator, like you're constantly learning new things. This has been a complete learning curve for me.
I think it's been for everybody. I think, especially in the field of people who are used to putting their hands on people.
Oh yeah.
It's been something that like is more of an adjustment than they ever thought or realized. I think everybody thinks like, oh, it's just online, I'll just put my stuff online and that's it. And it's like, no, it's not. Because it's not. Some people, there's a lot of skills that go into treating someone online, or just training someone online and just being with that person, because it's not the same attention. It's not the same. Like you're in different rooms. Like being in a room with you and talking is different from over the computer. You're in a different environment. You're home. There's kids in your back and they're screaming and like there's other things you have to worry about. So you can keep going, but like there's just that different aspect of it that changes, and it's hard.
Definitely. This is where I give you guys, like personal trainers, all the credit in the world. What I've had to learn through doing some virtual visits and things are the cues for people when you can't touch that person and put them into positions that you need them to be in. So being able to learn those verbal cues, I've never had to do that before. And I know with personal training, that's a huge thing that you guys are so great at. Well, should be great at it. I know Brandon's great at it. So, but that's been a huge thing, is that learning curve of being able to communicate with someone and getting what you know inside your head that they should be doing or should be able to do, but getting them to understand that, especially with certain movements, what is causing your pain, what is not causing pain. Does this movement here, oh, let's see if we can get that pelvic to tilt a little bit more. You're going too far. Like, all of those little cues are something that's been a huge learning curve. But I think it's been definitely interesting to learn and be part of that process now.
The coolest thing for me is like doing more online stuff is if you can do online training, like, or, you know, obviously you want to work with people first, because the best way to do online is to have experience in person and know. Obviously not everything's going to be the same, but like, you know, just have a broad understanding. And I've seen a lot that when someone brings a problem to you, it's not like, I don't know what to do here. It's like, oh, I've seen this before in person, so this is most likely what it is. But like I said, and I said this a couple minutes ago, like, I think trainers, I think chiropractors, personal trainer or physical therapists, I think they're right now focusing too much on the treatment itself, when I think right now there's a lot of good information out there for training, but I think that understanding the cueing, understanding how to actually communicate with somebody and not be an ass, and like understand that some people are not the same as other people, and you know, doing that online is, and just being able, and like I said, I think people mistake it for, oh, I can do this in person, so I'm just going to throw all my stuff online and people are just going to come running to me. And it's like, no. And like, there's a reason for it, because it's a completely different environment online and people learn differently. There's not, like I said, you're not in front of that person. So like being able to understand cues and being able to communicate with somebody is the most important aspect. And like for a chiropractor, again, you're used to putting your hands on somebody. So like not having the opportunity to put your hands on somebody is different. And like, I'm sure you have to be careful about what you say, because, you know, there's, again, on top of that, you're a doctor. So people take your word with, you know, and it's in a good way, but like it also, like, if you have to be careful what you say with somebody online, because you're not there. You're like, yeah, just twist your back this way. They're like, oh, like this. Well, I know you can't see, but
that brings up like, from your podcast with Jeremy, like how he says he doesn't go over diagnoses with people anymore. I'm the same way. I people live with a diagnosis. You'll have someone that comes in, and I see it all the time, where someone will say, oh, I have a disc herniation in my low back, like L5S1. Oh, okay. When did you have that? 10 years ago. You don't have a disc herniation anymore. Mm-hmm. Disc herniations clear themselves up within a year or 2 years. Mm-hmm. They reabsorb. So like people, that sticks in their head that like, I have a disc herniation. 10 years. No, you don't have that anymore. You may have some degeneration now because you clearly haven't used your back because you've guarded and been scared of it, clearly. But at that point, like, people live by their diagnosis. And if you're giving them things to be scared of, and like, no.
And you got to be careful with your words. And like,
absolutely.
Especially nowadays where like people are looking for their answer, like to what they think they have. So you got to be someone who, you know, sticks with your guns and not just like fills their ears with what they want to hear. And I think a lot of practitioners, and I think a lot of people who struggle, and they're starting to see that they can't, you know, I think there's a certain level of understanding you need to have, and a certain level of competence you need to have to become something more than just like your average chiropractor, your average trainer. But like I said, you know, the way you guys do it, and like I said, Jeremy, you, Jordan, you know, Dr. Nick, the guys that look at it from not so much this other view, like they look at it in a way that makes sense, which is, you know, not everybody's just going to need stim, and adjustment isn't what it is, what you guys learned, but like it's not the only thing. And like it usually isn't the thing that helps. Like, adjustments work, and like the problem becomes, again, the treatment itself isn't usually the thing that helps. It's a temporary fix, and it helps you kind of get out of pain. But then who has the knowledge to keep you out of pain is the most important thing. And like experience comes into play, understanding your own injuries and what you did for yourself, understanding the people that you work with and what is this person actually going to do versus what this person won't actually do. And again, consultation, assessment, understanding that person, and more so, instead of being like, oh, I'm going to spend all this time working on my treatments, which is good. You want to do that. Obviously you want to have up-to-date treatments and cool things to work on, but like understanding the beginning stages of a client or a patient is going to set you up for success. And it's going to make your life 10 times easier and help you get better referrals, more clients, and just help people more and be happier. If you're stressed right now, there's probably something that you're doing wrong, or you're not getting clients, or like you're struggling online. You know, it's not just the online space. It's just, you have to be more competent. You have to understand a little bit better, you know, and firsthand. Justin's a really good chiropractor. Like he's a, you know, he is a top level chiropractor, but you know, the online stuff is still hard. Doesn't mean you're just going to transition, and you have to just get better at certain things. It's a different thing, but this is teaching people to hone in on certain skills and increase certain skills. You know, I like doing the online stuff, but like, you know, again, it's different working with someone online. It's different working with a new person who's at home. You know, I have clients now that I work with that are in New York City, Las Vegas, like all these places. And it's tough because you're not there with them. And there's some things that like you kind of have to be upfront about and be like, listen, I need you to show me this. Like, I need you to tell me how this feels. You can't just kind of like blow it off. Like, because I'm not watching, you know, when you're watching someone in person, it's a lot different to be like, hey, you know, I'm seeing you do this. It's not that big of a deal, but let's try this. Whereas like they're doing that for 2 or 3 weeks and I don't see it in person. They don't tell me. You're like, oh, my back hurts. Like, oh, what are you doing? They're like, oh, well, I've been doing this for 3 weeks. And it's like, why didn't you do it? You know, but like, again, it's you have to adjust, and you have to make sure that you're getting better at that stuff. You know, Justin, we'll go over, we got a couple minutes left in this. What's going on with Unstoppable Movement? Because I've been seeing a lot about that, and then kind of where people can find you, and then put the plug stuff in there.
Oof. I got to remember one.
Yeah. I know he's got like 6.
So with Unstoppable Movement, what we're doing is myself, and another chiropractor in the area, Dr. Nick Patterson, we are collaborating on a movement, basically a movement program that we are trying to kind of change what chiropractic is in this area. We have seen, like we were talking about before, a lot of chiropractic in this area is still the old school thinking of, I need to see you 3 times a week for 4 weeks, 2 times a week for 4 weeks, and like continuing that trend. And it's something that's outdated and it needs to change. And so that's what we are trying to do, is we are coming up with new programs with movement, as well as rehab, treatment, chiropractic, a little bit of everything that we are starting to get underway here, and should be coming out shortly, probably in the next like months or so.
Cool.
And so, I mean, if you want to reach out to us, our Instagram is Unstoppable. Movement is MV.
I'll put the links below if you get.
So it's just Mvmnt movement. So Unstoppable Movement on Instagram. My page for Foundation Chiropractic and Magnolia Chiropractic, we're also on there, on Instagram and Facebook. Foundation Chiropractic is Foundation Chiro Wellness on Instagram, and Magnolia Chiropractic is Magnolia Chiropractic NY on Instagram.
Cool. All right. Awesome. So if you guys have any questions, please reach out. I got about 10 seconds left. Thank you guys for tuning in. If you have any questions for Justin, let him know. Hit him up there. And we will see you guys next time. Talk to you soon. Peace.
See you.